I hope you've had the chance to implement some of the concepts we spoke about, or at least had a chat to your team about some things you might be able to implement in the future. For those that did not join, my name is Roisin Sweeney and I am the Research Evaluation and Practice Lead at Injury Matters. Before we do get started though, I would like to acknowledge that we are meeting today on the lands of the Whadjuk Noongar people, or I am at least here in Leederville, and I'd like to give thanks for the honour that it is to live and work on their beautiful country, and also pay my respects to elders past, present and emerging from wherever you might be tuning in from this afternoon. Same as last week, some quick housekeeping. Everyone's microphones should be on mute, so that's all good. Please do use the chat box throughout this afternoon's session. If you have any questions or potential discussion points, please pop them in the chat. If you do have more than one person joining from your team this afternoon, please do let us know via the chat box if there's someone else joining. And if you do face any technical issues as well, Apu is joining us this afternoon to offer any technical support if needed. And you would have seen as well the recording has commenced for this afternoon's webinar. I'm not going to go too much into who we are and what we do, but please do jump onto the Injury Matters website if you aren't familiar with what we do as an organisation to learn more about our work. But today's webinar is brought to you by the No Injury Program, which is one of the programs that we deliver at Injury Matters on behalf of the WA Department of Health. And this program is really focusing on providing support to you as the WA injury prevention sector to hopefully build your capacity to go out and roll out impactful initiatives to support the community in preventing injuries on a daily basis. So this webinar is building off last Wednesday's webinar in terms of some of those foundational concepts that we did discuss last week. If you did miss last week's webinar, today's focus is different, so you will be able to actively participate in today's discussion, but the webinar is also available on the Injury Matters YouTube page if you do wish to go back and refresh on some of those concepts. For those that did join us last week, hopefully you're now more familiar, I guess, aware of the importance of evaluation, the different types of evaluation that are out there, those being process, impact, outcome, and formative, which I forgot at the start, and hopefully more confident as well to develop an evaluation plan for your project. And it was great to see in some of the feedback that you provided after last week's webinar that there were some key things that you could take away, and some of you identified that an evaluation plan is going to be key to getting that buy-in across the organisation to make sure everyone's on the same page in terms of what you are going out to evaluate across the lifespan of your project. Today, though, we are going to focus more so on the implementation and the analysis elements of our evaluation activities. So some core concepts that we are going to cover. We're going to talk about how we can collect this information that we need. So we have our plan, we know that what we want to deliver, what we want to collect, but how are we actually going to go out and collect this information? We're also going to chat through some cultural and some health literacy considerations to take into account when you are doing your evaluation activities. We'll touch on how to design an effective survey, because this is a common tool that we all use in our injury prevention activities. So we're going to spend a bit of time on this particular type of tool. How we can evaluate some of those evaluation challenges that we spoke about last week. I'm also going to spend some time talking about some examples, some concrete examples of how we can evaluate specific community-based initiatives, because we've had a lot of interest in this space from local governments and smaller projects that we are rolling out in the community to make sure we can do them justice in terms of what we are collecting for these type of projects. And finally, how we can share our evaluation results, because that is an important piece of the puzzle that sometimes gets left behind. So we're going to dedicate some time and some information to that as well. So these session goals, I guess, help us to work past the program planning phase of the WA Department of Health's evaluation framework and implementation guide that we spoke about last week. So those first couple of quadrants within the guide. And we're going to focus more so on the implementation, the review and the quality improvement, and the importance that these steps have in terms of our holistic view and the activities that we conduct within our evaluation. So hopefully that's all well and good. Everyone's in agreement. That's going to provide you some insight to support those foundational concepts that we've already covered. And as we have discussed last week in a bit of detail, when we are selecting our approach to evaluation, it's important that we consider the project's design. So, who are our target audience? What points of contact do we have with them, for example? Of course, our projects, I guess, aim, objectives, and reporting requirements are also hugely influential in terms of what we measure. But there's also some other factors that we should take into account when we are considering what approach we should take to our evaluation. So firstly, if the data potentially already exists or is there another tool out there already collecting this piece of information, we don't want to invest our resources into continuously adding to this bank of information if we can extract this information from a different source or a different survey potentially that's already been conducted across the whole state, for example. It's also important that we consider what are the literacy levels of our target audience. How can we use different culturally appropriate methodology in our evaluation work? What are the skills and experiences that we have on hand within our project team or potentially can lean on within our broader network of stakeholders? And again, an ethical approach to our methodology is really important. Another really important consideration and one that we're really passionate about at Injury Matters is cultural safety. So the definition on your slide here is from the Secretariat of the National Aboriginal and Islander Childcare, and it is defined cultural safety as the positive recognition and celebration of cultures. It is more than just the absence of racism or discrimination and more than cultural awareness and cultural sensitivity. It empowers people and enables them to contribute and feel safe to be themselves. So I think we can all agree there's some key elements of this statement that resonate with us in the values-based work that we do across the injury prevention sector. And in a culturally safe environment, we want to make sure that presence is welcome and respected, experiences are believed and validated, cultures are centered and valued, advice is listened and also importantly acted on, and that there is no racism in what we're doing. So I'm sure these are already foundational values in terms of all the work that you do across your organisation, but it's important that we don't lose sight of these when we are doing our evaluation activities as well. So when we are practicing these cultural safety behaviours, we're helping to address the imbalances that exist within our society across different cultural groups, and ultimately enables us to make better decisions about how we can support the community that we're ultimately helping to thrive as well. An evaluation, I guess, is a key process or concept in terms of highlighting individual and community strengths and supporting that self-determination nature of what we're trying to do. But in order to achieve these aims, best practices for the evaluation of programs that specifically target Aboriginal and Torres Strait Islander people to be led by Aboriginal and Torres Strait Islander people. And if you work in a mainstream organisation or a non-Indigenous evaluator such as myself, forming these partnerships with Aboriginal and Torres Strait Islander peoples is really key to the success of your evaluation project, no matter what the scope of the project is, but particularly those that are targeting Aboriginal and Torres Strait Islander people. If it's not possible for you to collaborate with local Aboriginal people on your evaluation activities in particular, it's important that we do consider some key values and approaches in order to implement this culturally safe approach in our evaluation activities. So things like valuing Aboriginal and Torres Strait Islander, their culture and their knowledge, building positive relationships with those Aboriginal people within and outside the project, placing Aboriginal people like we would any target audience at the centre of all of our decision making, and ensuring that we're using reflective practices towards this holistic view of health. So these concepts are not just applicable to when we are doing work with Aboriginal and Torres Strait Islander people, because they are going to strengthen any form of evaluation that you are doing, but they are integral specifically for those projects we are conducting with Aboriginal people. It's important that we don't just facilitate these partnerships at the tail end of a program, that we are integrating the evaluation expertise of Aboriginal people during the formative phases and are testing tools, for example, and conducting analysis and thinking about knowledge translation with them so we can get the best buy-in into all of those concepts. And Sometimes some of the suggestions or some of the approaches that might be needed in this context, I guess, may challenge what we might consider a mainstream approach to evaluation and some of the methodologies that we're going to speak about today. But as long as the approach focuses on what is best to collect the data to reflect the success and the challenges of the program, that ultimately is going to meet the needs of the target audience and what is most important to them and what is going to achieve program success, that is what is of most importance. So sometimes we might have to pivot our thinking a little bit in terms of what's the best tool that we can use in this setting to gain the best feedback possible. Although there is, I guess, no perfect answer to any of these challenges and potential strengths of your program, there are a couple of resources on your slide and some more at the end that do outline some different approaches that you might want to consider when you are planning your evaluation activities, when you are working with Aboriginal and Torres Strait Islander people. But again, there is no perfect template to follow. Another important consideration is the literacy levels of your target audience. So often our injury prevention and harm reduction programs in particular target priority population groups that might include individuals that have low literacy levels. So no matter what our program is and what we are or who we are targeting, I guess in the community, it's important that we understand our target audience and that we are evaluating, I guess, developing evaluation tools to best engage with those groups. So this might include mitigating any potential barriers that individuals may face to completing an evaluation tool, one of those which might be low literacy levels, for example. And if we take literacy as an example, if we are increasing the accessibility for individuals with low literacy levels, ultimately we are making the evaluation more accessible for everyone that's involved in the project. So why isn't that something we should consider without any project that we're rolling out? But some key things to consider that are on your slide at the moment, if you are in particular seeking a high response rate from individuals with low literacy levels, is making sure we're using plain language and that we do pilot test our tools with the target audience in particular. So we're not making any assumptions about their potential interpretation of the tool. If possible, it might be helpful to include some non-written collection tools within your evaluation plan. So you might do some observational analysis, for example, or you might use some pictures instead of words, or you might do some interviews with the target audience, so less reliance on some of those written tools that we may use. If you do foresee that a survey is still best placed to collect the data from your target audience, you might want to facilitate that verbally with the respondent. We want to make sure the format is as clear as possible, and you might want to give just some extra time for respondents to really understand and unpack the information before they're able to provide a response. Regardless, I guess, of what type of valuation you are conducting, it's important that we really understand our sample group that we do want data from and how we can best reach them. In some cases, who our sample are might be really obvious because they're just your primary target audience that have engaged in the project. But it's also important that we consider some other people that are potentially influenced by the initiative. So if you're rolling out an initiative for high school students, for an example, your primary target audience is the students themselves. So you might include some of them in your sample group, but you might also consider some other people that are influential, that are indirectly influenced by the project. So the parents of the participants, the teachers, policymakers, for example, friends of those who directly engage might provide a different context to the feedback that you are given. Secondly, timing is everything. Ideally, the timing of your evaluation activities is heavily influenced by the timing of your project's implementation as a whole, but it's important that we consider how we can best engage with our sample group at particular points in time. So if your evaluation design suggests that the project ends and you're doing a follow-up 3 months later, for example, and it ends up being in December of this year, and your primary target audience and who you want to make up the majority of your sample group are made up of health professionals, December and January probably isn't the best time to be reaching out to your target audience to get some feedback, because we know it's common for people to take extended breaks during this holiday season, or they're trying to wrap things up for the end of the calendar year as well. So making sure that the sample group is accessible when you are reaching out to them. Being able to identify our sample is great, but we also need to be able to locate them. So where are our sample group located? So during the planning phase, you might want to consider how you're going to find your sample. Are they commonly located in a particular location, for example? So you can then do some intercept surveys or some interviews at that point of time, or you're going to have to be a bit more strategic about where they are because they're not often congregated in the one location. And finally, on the slide there is recruiting our sample. So if your sample are located somewhere, so maybe you've just done a presentation, so you know that everyone's going to be there directly after the presentation, so you can ask them some questions at that point in time. Perfect, nice and simple, low resourcing activity. But otherwise, you might need to consider how you're going to recruit them and how you're going to make sure they're an appropriately sized and representative group as this part of the sample group at large. So you might need to think about how are you going to invite them to participate. So are you going to give them a phone call to do some follow-ups? Are you going to do some direct emails? Are you going to do some social media advertisements to reach the particular proportions of the population? Think about, yeah, how are you going to recruit your people as well as part of your evaluation strategy? In terms of the tools themselves, I guess once you know what approach you're taking to your evaluation activity, you now need to consider what tools am I going to use to collect this information. The figure on your slide here is taken from the Australian Institute of Family Studies website, and I feel like it just provides a really nice pictorial of how we do not always need to create evaluation tools ourselves. We need to make sure we're stopping, taking the time to check if that information is already available, either amazingly as a collected sample or even just the tool itself that we can utilize. So yeah, definitely feel free to refer back to that flow chart. I find it really valuable myself in the work that we do. But no matter what your evaluation plan is that you've already perfected by this point in time in our evaluation planning journey, you are likely to have a survey tool at some point in time. Might be a large scale survey or just a one off. And so over the next few slides, we're just going to chat through how we can effectively design this survey tool to make sure that we are getting the most out of it. So there are different types of questions that you might include in your evaluation tool. So hopefully fairly obviously on the first slide here, a dichotomous question is a clear-cut question. It only has two options. So on the example here until you can see that if we follow on from last week's example, we've rolled out some e-scooter safety workshops up in Geraldton. And we might then want to do a survey after we've rolled out the workshop or a follow-up survey a couple of months later. We might just start with a simple question. Did you participate in the workshop? Yes or no, clear-cut responses. Next on the slide there is multiple choice questions. So again, fairly straightforward. We want respondents to select two or more responses to a single question to provide us with greater insight into that particular topic. Thirdly, here is a Likert scale. In public health, we do love a good Likert question. That's because it really does enable us to quickly capture multiple responses to a single question or within a particular scope of practice. And the question structure, I guess, is as on your slide at the moment here. It's got a description to assist the respondent to complete the scale. And then there's usually 5 or more responses, choices available for the individual to select per statement. As you can see on this example here, the statements that you're going to be asking the individual to respond to do not necessarily have to be from the same project objective that you already that we spoke about last week. But it's important that the flow of the questions make sense to the reader or to the respondent, so they can easily work their way through the statement. So we don't want to be jumping around to like more formative style questions to impact questions. We want to make sure it's kind of a funnel approach to individuals' responses. Another question type that you might find helpful, particularly if you're doing some formative work, is asking respondents to rank their preference using some items that are provided. So in this example, if you want some insight into the type of physical activity potentially your target audience are conducting already to help inform what type of intervention you'll roll out or offer to the community, you might ask them just to simply rank 1 to 5 here, what is their preferred choice of physical activity, to then inform what type of intervention that you're going to deliver. Your survey might also benefit from some open-ended questions. These are commonly used in formative and process evaluation activities because Participants provide answers using their own words, and these words themselves can be really insightful in terms of what terminology you should be using in your everyday language as well. But they can be more time consuming, both for respondents to complete and also for us to analyse when we do have the responses collated. So it's important that we don't load our survey with too many open-ended questions, but combining both closed and open-ended questions can be really valuable in ensuring we are collecting a really rich data set. I guess the tools themselves are really important, but is how we structure our survey. So we need to construct it as a tool, not just see it as a whole group of isolated questions. Even if your sample group is fairly familiar with conducting surveys. So for example, you guys today joining the webinar, I'm sure have completed a whole number of surveys in your life, but we still want to make sure that when we are disseminating a survey, we're providing a brief description and some instructions about how individuals should go about completing the survey. We also want to use language that's appropriate for the target audience in particular. We want to structure the questions so the more sensitive questions are in the middle or perhaps to the end of your survey. And this just allows the respondents to have more context about why we're asking the question before they're giving a response. They might be more honest then in their responses because they know how we're going to be using them when they are collated. We also want to include a variety of question types. So as mentioned before, we don't want too many open-ended questions. We want to include a whole variety for people to complete. Don't crowd your tool. White space is so important. So don't feel like, oh, I've got a page, I'm just going to jam a whole heap of questions on there. Make sure we are leaving some space for people to work through the questions and using validated questions where possible. So those tools we spoke about last week from ABS or AHW or Department of Health, for example, leaning into those where possible. And there's some things to do, I guess, to do a good survey design. Apparently not meant to mention what not to do when you're talking about things like this, but I think it is important that we do just chat through some key components of a poorly designed survey, just to make sure it's easy for us to identify them when we are unintentionally doing them within our work. So firstly, here we have double-barreled questions. These are super easy to include in your survey. So it's important that when you are reviewing your tool, you're cross-checking to make sure that none of them do have double-barreled questions within it. When we're talking about double-barreled questions, they are those that include two separate concepts within the one question. So ideally, we want to separate these out into two different questions so people can provide specific responses on each. And in this example here on your slide, where you can see there in the underlined text, we're asking people about if it has increased their knowledge on a topic and also how they can prevent the said injuries from occurring. So participants might have two different perceptions on how the said activity has successfully achieved both of these objectives. When distributing a survey, I guess we always have an agenda for what we want out of that tool because it's coming straight from our valuation plan. So we know what we want answers to, but it's important that the respondent is not influenced by how we are wording our questions. So by loading our questions in a certain direction, it can direct the individual to respond in a certain manner and therefore create some bias. So in this example here, do you agree that alcohol support services should receive more funding? It's putting the idea in people's head that, oh yeah, of course it should. Why should I challenge that statement? So we're already biasing the respondent in a certain direction that is supportive of our cause. Now, I'm sure we've all, I guess, completed a survey that has been a lot longer than it needed to be, or perhaps a lot longer than you expected it to be. So, if we are distributing a long survey and you can't avoid that, it does have all of the questions that it needs. It can reduce the likelihood of all of your respondents completing the full length of the survey. So, to mitigate this, we need to be sure that we're reviewing the survey to cross-check that are all the questions actually needed and meeting the particular purpose of that survey tool. But it's also important that if it does have to be that length or regardless of its length, that we are giving respondents an insight into how long it is expected for the individual to complete that tool, just to give them some, so if it's going to be a 15-minute tool, gives the person the opportunity to allocate 15 minutes of their time and not feel like they're rushing through it at the end. And a progress bar can also be really helpful to give the respondent a visual in terms of how far they are progressing through the tool. Again, on a similar vein to what we just discussed, is making sure the questions are clear and cannot be interpreted in multiple ways. So there are some words that are often used in questions that can potentially be open to different interpretations. So these include things like important or major or better or often. These terms in particular, you or I could interpret differently. So making sure we are, where possible, taking these types of terminology out of our questions. Because if we're not specific about them, we're ultimately not ending up with the robust data set that we want at the end of the day. Also important is if we're not specific about what context we are asking that question in, it can lead to imprecise responses. So on the slide here, if you're asking someone, how many major injuries have you had? That's it, that's the only question. It can lead to a whole different range of responses. But if we're asking someone how many injuries have they had in the last 12 months, and making it time specific, that required treatment by a health professional, so severity specific, it's making sure the respondent is clear in terms of what scope they are answering this question in. And finally, here is we need to make sure we're not presuming any knowledge on the respondent's behalf, either in terms of their knowledge base or in terms of their experience in the particular project that we're trying to evaluate. If this is the case, we need to use a filter question where possible, because it can help to segment out our respondents to make sure that only those who can provide knowledgeable insight are given the opportunity to do so or can respond in an informed manner. Or if not, that's not the case, if it does require potentially some background information, we can just simply include that context before the question so that all respondents are aware of what baseline understanding they should be considering this question in. An example on the slide here, I guess, is around how many times someone has fallen in the last week. We might want to ask them, did they have a fall, before we ask them how many times they have fallen. So again, setting that time parameter in terms of when they are responding, in terms of, we're always talking about the past week. So that's great in both example questions, but we want to ask them first if they have, because otherwise there might be follow-on questions that are redundant or filter questions for that individual. So that's some examples there of what not to do and hopefully what to do to counteract some of those common challenges. And it's something we all should visit, no matter how often we are rolling out surveys publicly. We should always be cross-checking those different things before we do roll out the tool. If we move on now to survey validity, this refers to if the survey is measuring what we're actually trying to measure. And if you were to do a full assessment of a tool's validity, it would require these 4 different processes. So if the items measure what they're meant to measure, if the items measure the objectives that we've already set out, we might want to do a comparison of results to an equivalent test or equivalent data set. We want to assess if the tool is predictive of future values, and we also want to assess if it's related to other concepts as expected. So that's how we would assess the validity of the tool. And in a similar vein to validity, people talk about reliability. So survey reliability refers to if the tool is providing the same results on a repeated basis. In order to, I guess, in an academic sense, fully assess the reliability of a tool, you do have to do a test retest with that particular tool with a group of respondents. And a test retest is very challenging because ideally you need over 200 respondents to complete the tool, and then under the same conditions, potentially 2 weeks later, for example, complete the same tool. So there's a whole heap of challenges within this. Also because when you are retesting, the respondent themselves might have changed their perception on the topic, so their follow-up response might be different due to no fault of the question itself. I guess we can understand within our work, survey validity and reliability are fairly in-depth concepts to do when we are rolling out, particularly if it's just a one-off tool that we are doing following a community event, for example. But the components of validity and reliability testing are still things that we should consider within our work, and again, reinforces why we should be using those validated tools if we do have access to them. So again, some sample tools that you might want to check before you go and develop your own tool, because they have already been validated, so you can have that confidence that the questions within them are going to meet the needs that you set out to achieve. And in summary, I guess, of some of the key concepts we've just spoke about on the slide here are just some questions to ask when you ask yourself or ask your team members or ask your sample group when you are out and about reviewing your tool. This just really helps to eliminate some of those poor design features that we've spoken through earlier. Ideally, you want to be able to answer yes to each of these questions, but I do acknowledge that in the sixth one there, in some cases, we might have multiple questions that are collating similar types of answers or potentially the same answers, and this might be for strategic reasons. So you want to ensure the answer is correct. So you've asked it in two different formats across your survey tool. So definitely want to be able to answer yes to the first five, but number six is also one to consider when you are critiquing your tool. And just some final I guess points regarding surveys in particular. Response rates are often a talking point when it comes to surveys. Ideally, you want a response rate of more than 65% of your sample group, which is why it's so important to consider this when you are setting out your sample group parameter. For example, it's highly unlikely, but if you posted a survey out, for example, to 2,000 households in your local government area and you received 1,300 responses back, that is a lot of information to enter and also a lot of information to analyse when it does come through. So yes, you've achieved the predetermined response rate, but potentially you set your sample size too large. So you can rein that in as well. And finally, there on the slide is the number of responses is important, but we need to make sure that the responses that we get back from our sample group are representative of the group at large. So we need to make sure that this is the case because the non-respondents might be biasing the responses that you have received. So again, during that analysis phase, making sure that the demographics of the group is considered. And in terms of administration, finally, in terms of when you're thinking about rolling out a survey, there are 101 different ways that you can administer a survey these days due to all the different types of technology that are available to us. But it's important that we consider, is the option we're going for the best suited for both us as the administrator of the tool, but also for the respondent as well. So maybe an online survey software, so SurveyMonkey or Microsoft Forms, for example, might be great because their results are already collated for you, but you actually, well, that's not going to work for this target audience. We do need to do a paper copy because our target audience have low computer literacy, for example. So they do need that paper-based copy just to help increase the response rate that we do get at the end of the day. How we distribute the survey will be influenced obviously by the type of survey that we are rolling out, but it's important that we consider the terms that we are using in the communication strategies when we are pushing out the survey. And finally, we need to think about how we're going to collate the responses. So it's all well and good sending out those 2,000 paper copy surveys, but if you do get 1,300 back, do you have administrative time to be able to input those responses before you then move on to the analysis? So lots of pro cons to weigh up when you are considering how to roll out your survey. And just moving towards the end here now, we're going to talk about mitigating some of those evaluation challenges that we did touch on last week. So there are a number of challenges. I'm not going to stand here and say that evaluation is the easiest thing you can do within your project because you do have to, like any part of your project, mitigate different things along the way. So you might have some things we spoke about last week around like limited resourcing, different agendas amongst different people within your project team. You might have a quick turnaround that's required after you've obtained the data. You might have a poor response rate, so how are you going to deal with that? So making sure that we're doing as much as we can in that planning phase that we spoke about last week when we are developing our plan to make sure it is like set in stone to some degree. Everyone's on the same page in terms of what we do roll out, just to when those issues do arise later on, we've then got a plan in place to deal with them. Second on the slide there is around pilot testing our tools. So again, key just to making sure that the data we are seeking from each tool isn't misinterpreted along the way. Complementary tools is probably something we haven't spoke about yet, and this is in terms of we don't want to rely on one evaluation tool to collect all of the data that we need to report back or to help improve the product that we're rolling out, because that can be risky, particularly if the tool falls through or you don't get the response rate that you required. So having multiple data collection tools along the way can really help round out your data set as well. Incentives, everyone loves winning a prize or everyone loves being compensated for their time. So if you do offer an incentive, it can help to increase your response rate or to engage with a particular part of your target audience as well. And providing information. So we spoke about last week around those information sheet templates, giving respondents some information about why they're completing the tool can again help to make sure that they are giving the most insightful information possible. I'm not going to touch on existing tools because I think I've spoke about that enough. And as we said, software systems can be really key to making sure that some of that administrative burden is taken away if possible, of course. And just for the last few minutes here, we're going to chat about community activities in particular. When you are rolling out community-based injury prevention activities, it can be challenging to implement more traditional evaluation activities because you might not have the time available in the activity itself to complete the structured evaluation. So if a post survey, for example, might not be possible, or you might not have the contact details of your participants to follow them up at the later date. So this increases the importance of us gathering the feedback from the individual when you are engaging with them out in the community, no matter what format that is. So when we are evaluating these community activities, you might find that a survey meets your needs, all well and good. You now know how to design a perfect survey, so you can go out and roll that out. But there are different options available to us, and some that I think we don't dedicate enough time to. So you might want to consider some one-on-one interviews, for example, with people that have engaged in your activity, particularly if you've taken the time and resourcing to provide tailored support to people. You might find that structured questioning or structured interviews are really insightful in terms of understanding the impact that had on the individual in particular. If you are rolling out a group-based initiative, you might find that it's okay to facilitate this interview concept during breaks, for example, during your initiative, or you might be able to do it in a focus group, of course, only if the information you're collecting isn't confidential. If participants are able to provide information during the activity themselves, so the pictures before about some of the community activities we roll out through our Stay on Your Feet program, if you are able to gather some information from people who are there on the day, you might find it helpful to do a scale, for example, either smiley faces or 1 to 10 or whatever it might look like around some of those key objectives that you do have for the community event that they are attending, for example, so they can then go and put a post-it note or put a note on a mark on a scale of where they feel they sit on that range. You might, if you do have, I guess, more agreement-based indicators, you might be able to get some of these responses in a bit more of a visual format. So you might do the good old marbles in a jar, for example, or you might do a modified bullseye to collect some of this information. There's a whole different range of, I guess, physical representation that is available for us to collect this information. If you have staff availability, which I know can be a luxury, observations can also be really insightful in terms of watching people, watch what they do, listening to what they say, monitoring how they act. If you are considering this form of data collection, it can be helpful to have a template for your staff member to note down this information. And of course, if you are recording or taking photos of your participants, making sure that you have obtained their consent before conducting this evaluation, the same as we would any type of activity that we are doing. I am conscious of time, so I will skip over this, but the Stay on Your Feet program does a lot of community-based activities. As you can see, there's some indicators that we collect on the slide here, and we do collect this using all those modalities that we just spoke about before. And of course, we do roll out a survey. We try to reduce this burden, so we only do it at presentations quarterly, just to make sure we have a sample pool that is representative of all of our attendees. And it does provide an opportunity for people to enter into the draw to win a gift card as well. And this probably could be a whole webinar in its own right, but it is important that I do note that how we analyse and interpret our data is also really important. So when you do have your data set, it's important that the main themes are summarised for each data set and that you also do frequency tables or graphs potentially for the different indicators that you are trying to assess as well. So when we are at this phase of our evaluation, making sure that we are systematic in what we're doing to make sure the results aren't misinterpreted or skewed potentially in favour of our preferred outcomes as well. And finally, knowledge translation. Again, could be a whole webinar in its own right. It has become somewhat of a buzzword, I guess, in academic landscape in general, not just in public health, but it is an important factor for us to consider when we do have our evaluation results or our data set, who needs to hear about this information and how are we going to get that information to them. So not just considering, I guess, more traditional forms of knowledge translation in terms of academic presentations or journal articles, how can we do some infographics or some summaries or some snippets for the news, for example, to share this information more broadly, particularly back to those that have engaged in the program. So we want to share the results back to those that took the time to give us some feedback, because it shows that we not only valued their time, but the impact, the feedback that they've given us has helped to inform our future activities as well. And just some final recommendations here to wrap up. Do prioritise your sample group. Without them, you will not have a data set. So we need to make sure that we're tailoring all of our activities to their needs. Ask for suggestions. So I'm sure people in your team or your broader networks have attempted to engage with your particular target audience or have conducted some evaluation on that topic before. So lean on them for suggestions and advice. We've spoken about this enough. Validated tools can be really helpful. Also spoken about pilot testing our survey tools to make sure they're collecting the type of information that we want. And finally, there is not overcomplicating our methodology. So even though last week we might have potentially finalised a plan based on the concepts that we spoke about, making sure when it doesn't come to tool development and tool rollout, we're also not complicating that methodology either. Again, a number of links to help you visit at a later date if you do want some more insight to any of the concepts that we've spoken about today, and also some references there if anyone wants to refer back to them also. We do have 2 questions, but we do have a couple of minutes as well if anyone wants to pop any more in the chat. So the first question here is from Joe. If you utilise both digital and paper-based surveys, what is the most efficient way to bring that data together? Great question, Joe, and something that we do face here at Injury Matters in terms of potentially we've rolled out a workshop, a physical workshop, and we've handed out some paper-based surveys there, but then we've missed a couple of people that didn't complete it. In the follow-up email with different resources, we might also include a link for those that haven't done it. We do have to be clear in terms of only complete the survey if you didn't complete the paper-based copy on the day. But what we do is we do centralise both our paper and digital based copies in the one location. So utilising either SurveyMonkey or OneNote, making sure that all of the physical copies are entered into the same database that the digital ones were. If you're not using a software like that and you're just collecting it in an Excel document, for example, making sure that those 2 data sets do come together. Sometimes we do find that it's interesting to analyse them separately because you might get different responses from both target groups, particularly within our older adult cohort. The type of people that are completing a physical survey might have a different response to people completing the digital survey. So we might do some segmented analysis on those, but ultimately we want to make sure that both data sets are coming together in that digital version. And once we're confident that we do have a digital copy of everything, we do then discard the physical copies. The second question here, could you elaborate on assisted surveys? Are assisted surveys usually via phone or in person? So I think this would have been referred to at the start of the presentation when we were talking about literacy levels. So we're talking about an assisted survey. That's more so if someone needs support to answer the questions themselves. So in some cases, you can just give someone a paper-based copy of a survey on a clipboard and they'll be able to go through and answer those questions themselves. You can come back and collect the tool at a later date, but in some cases you might need to talk the person through the questions themselves just to make sure they're clear in understanding it. A whole nother layer on top of that is if you're trying to engage with a group that potentially English is their second language, you might also involve an interpreter in those conversations as well. So helping them to translate the survey, obviously someone that you trust is translating them correctly and a part of your project team ideally, to then make sure the responses are as accurate as possible. Cool, that's all the questions. Just to wrap up here, we do have a few more trainings coming up this financial year and we'll be rolling out a whole heap moving into next financial year. So definitely keep an eye on those. And again, please do take time now to complete the survey that Apu's popped in the chat, and we'll also send it out with the follow-up email with this copy of the slides and some links to those resources as well. So definitely want your feedback. Please help our response rate by completing the survey. But that is all for today. Thank you again, especially those that took the time last week and today to join the webinar. Please do continue to connect with us. We are here to support you through whatever means necessary, through our networking groups, through our training opportunities that we have. So yeah, please don't be a stranger. Thanks, everyone.